There is something I want to quickly say. Just a quick one. When you go to the hospital to see your doctor, there are things that are expected of you to know. Hello, welcome to my page. My name is Ifechukwu Prudenciana Okachukwu. I'm a registered nurse, a midwife, and a family planning provider. There are information you need to find out from the doctor, the pharmacist, or the nurse. Many a times, we go to the hospital and we'll be carried away. Most of us will be fighting for number, dragging numbers. I came before this person, I came before that person, this, that. And at the end of the day, you will go home without knowing your diagnosis. You will go home not knowing what is wrong with you. In as much as you have number 1 or number 2, always bear in mind that you are in the hospital. And the tendency that you will not even be seen as number 1 patient is high. Because once we have an emergency, that person becomes number 1. That doesn't mean you will not be seen. Stop dragging for unnecessary things. What I'm trying to say in essence is this. When you go to the hospital to see your doctor, first of all, find out from the doctor what is wrong with you. Ask the doctor what is your diagnosis. It is your right as a patient to know your diagnosis. Ask the doctor what is wrong with me or what is wrong with you. He or she will tell you. Know what is wrong with you when you go to the hospital. Secondly, find out what medications the doctor will be prescribing for you. Ask him, what are the indications for the medication? How will it work? How will it help you? Ask the doctor any side effects with regards to the medication. Know how many medications the doctor is prescribing for you. So that when you go to the pharmacy to collect the medication, you'll be able to know, okay, I have 1, I have 2, I have 3. If they are complete, you will know. But whereby you don't know how many medications prescribed for you, how will you know if it is complete or not? Ask the doctor how long you will take the medication. And don't go home after completing the medication, you go and buy another one. If you are taking any medication already, ask the doctor if there will be interaction. Will there be any effect, any side effect with the one he's prescribing and the one you're already taking at home? Find out, and if there will be any interaction, any side effect, what will you do when it starts? Do you need to panic or not? Sometimes some medication will have diarrhea or constipation or stomach upset, but because you didn't even ask your doctor, once you start having diarrhea or something, you'll be like, that doctor gave me a wrong medication, that nurse, this, that, and that. Because you did not ask the question you're supposed to ask. There is something we call expected side effects. Even paracetamol has side effects. So, and there is difference between side effects and adverse effects. Side effects are those effects that when you have it, you don't need to create any alarm. You see it as if it's normal. But adverse effects are those ones that are life-threatening, that once it starts happening, you need to rush to the hospital for urgent care. So find out from your doctor what is wrong with you, your medication, your investigation. If the doctor wants you to go for any lab investigation, find out what is the name of the investigation and why the investigation. How will it help in your treatments? Don't go home empty without even knowing what is wrong with you. Fortunately and unfortunately, some hospitals will give you medication, removing the carton and the labels. It is your right as a patient to know the name of medication you are taking. Don't go home with medication inside a white blank envelope. And once they remove the carton, the labels, they will just write 1 times 2, 2 times 3, and 3 times 3. Do not go home with such envelopes. Ask your doctor what is the name of the medication and insist on going home with the labels. It is your right to know. Because it doesn't make sense that something was bothering you and after going to the hospital, you will come back without even having an idea of what the problem is. Yet, you are taking medication. It doesn't sound nice at all. So, whenever you go to the hospital, please concentrate. Don't drag for unnecessary things. Don't lose guard. Ask questions to the nurses, ask your doctor, ask the lab technician, ask the lab scientist, ask the pharmacist. They will answer you. Very few don't tell the patient except they ask. So ask. You will be answered. If this video is useful to you and you would like to have more content like this, please hit the follow button and don't forget to like, comment, share, and follow me on all my social media handles and subscribe to my YouTube channel. Until I see you again in my next video, please do take care of yourself and drink plenty of water.